what would be a good strategy? And I'll come to you first then in primary care. If somebody's measuring their blood pressure, say at home, and blood pressure is good, and they think they might be overtreated because they're having dizzy spells or the blood pressure is kind of dipping, what would you typically do? Would you wean down one gradually or cut one? Well, what's the way you think?
So it depends on which medications you're on and how much. So if you are on a very small amount of a medication, so that's what you have to find out first, working with your doctor and doing your own research. So if you're on a very small amount of blood pressure medication and you are getting, these dizzy spells or your blood pressure's very well controlled or even low, if you're on a low dose, you might be able to just stop it. And you could talk to your doctor about, hey, can I just stop this medication? Keep checking my blood pressure at home. And, buying a blood pressure cuff is always so helpful to get a lot of data to figure this out. If you're on a few blood pressure medications in high doses, yeah, usually what I do is pick one, cut it in half, and then see how the person does, and then maybe get rid of that one. I always like to eliminate one fully before working on the others, you know, because the goal is to get you off, right? So as many as you can get off is the key. That's usually how I approach it. But you have to be careful and you have to know what the medication is. For example, there's one called clonidine that you guys are catapris. That one can have rebound hypertension. What that means is if you don't take it, you can get this, you can shoot up. So you have to be very careful getting off that one and work with your doctor on that one. So that's just an example of what, where to be careful and you have to know what you're doing.